Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Well, I am back with Washoe County District Health Officer Kevin Dick to discuss some other major health issues we see in this community. Thank you once again for your time.
Oh, thank you.
Appreciate it. Okay, so we're nearing the end of flu season, right now?
Yes.
How was this one overall?
You know, this was a much easier flu season than the last one. We had a better vaccine this year. It was about 3 times more effective than the vaccine last year. And we had a flu strain that was much milder. So we had kind of a later peak for flu. It wasn't as high as last year, but for those that got it, it was much milder. We had a significantly lower hospitalization rate, much fewer deaths attributed to flu. So we feel pretty good about how we came through the season.
Yeah, that's good to hear. Okay, I want to touch on Zika because it's obviously been in the headlines a lot, and we had our first case in Washoe County not too long ago. How big of a concern is this for you?
Well, it's a concern, but it's mostly not a direct concern within our community. Our concern is more in relation to people that are traveling to areas that have Zika. So South America is where most of the attention has been, and some of the Pacific Islands. And when they come back, either that they may have Zika, or the only way that somebody would get Zika here, other than coming back with it, is that we know it can be sexually transmitted. Right. So we're not concerned about mosquito transmission here. We don't have the Aedes aegypti mosquito that is the one that's responsible for transmitting that virus. But people need to remember we do have West Nile virus in the area here typically, and so they should still be protecting themselves from mosquitoes to avoid that.
Okay, and if you know someone or you're in a relationship with someone who's traveled to those countries, practice safe sex or no sex?
Yes.
Okay, good to remember for everyone, because some scary stuff comes out of that. All right, let's talk about another thing that came out of that report we mentioned in earlier in the show. The STI transmission rate in Washoe County is unusually high. They tested for chlamydia, and it is way higher than the national average. Why?
We're seeing very high rates of sexually transmitted diseases. In Nevada, we're not quite as bad as Clark County yet, but we're seeing a significant increase, and we don't want to get as bad as Clark County. I recently did a presentation to the Legislative Committee with Southern Nevada Health District and Carson City Health and Human Services, and we had all identified sexually transmitted diseases as a significant issue that we're facing. We have invested additional resources in our program to be working to investigate with people that do get tested positive, to identify partners and try to head off that disease outbreak. We're very concerned with syphilis, where we've seen a tremendous increase of over 1,000% in our syphilis rates over the past 10 years. And so we've launched advertising in some of the media. We've done outreach to all the physicians in the community. But one of the things that we think is driving these rates, not just here but nationally, are some of the hookup apps with social media. So there's Tinder and Grindr, and that are just really designed for somebody to meet somebody else quickly and hook up. So we are actually doing social media advertising on those apps to remind people to get tested and how they can contact our program and come in for that. But I would just very much caution people, be very careful, and birth control does not protect you from a sexually transmitted disease. So for people to remember, that doesn't provide that protection, and so you need to use a condom and practice safe sex, even if you have birth control taken care of.
Absolutely. Okay, and we've got resources that we can put up on our website as well if people need to get more information about all of this. We're also going to put a link to that study if anyone wants to take a look at the health rankings for the county, which is interesting, but we are just about out of time. Anyway, Kevin, thank you so much for your time.
Thank you.
Really
It's been a
appreciate
pleasure.
it. That is it for this episode of Face the State, but for more information on all of this or to see past episodes, once again, just head to our website. That's ktvn.com. Thank you so much for being with us. See you next week.